That's not what we're learning in medical school. Like there's a certain curriculum, right, that's being taught. Why is your body gaining weight? Well, a lot of times it's because it's trying to make more estrogen because fat cells
Wow.
make estrogen. But if you think about surgery maybe as like going into a sporting event, right? You wouldn't starve your and dehydrate your athletes before they go into a performance,
Yeah.
right? A physical performance.
Thank you for watching. Please take a moment to like this video and subscribe to our channel if you haven't already. Every like and subscribe is a free way to support us, expand our reach, and plant new ideas. Where were you born? What is kind of like a little bit of your origin story, just kind of rolling into it here now?
Yeah,
Mm-hmm.
so I'm Japanese American. My
Mm-hmm.
father was born and raised here, so his parents immigrated from Japan,
Mm-hmm.
and he fought for the Americans in Europe during World War II. He fought in Italy and France during World War II for the all Japanese
Wow.
unit. And then my mother was being bombed by the Americans in Japan during World War
Oh
II because
my.
she was born and raised there.
Wow.
And apparently, according to my mother, there were only two countries allowing Japanese citizens into the country after World War II, which was, I think, Switzerland and Japan.
Mm-hmm.
But you needed a sponsor to be in the States. So I think my grandparents knew each other somehow. So they sponsored my mother to be in the US after World War II, which is how my parents met.
Hmm.
And then my parents farmed in Eastern Oregon. So I grew up on a small family farm in Eastern Oregon, potatoes, onions, wheat, sugar beets, things like that.
Wow.
And then I think just growing up on a farm, you have to be kind of resourceful and you're
Mm-hmm.
around mechanical things a lot. So I started out as a mechanical engineer, and where I went to college, they had a product design program, meaning I took a lot of classes from the design department and in the art department. And so I was interested in, I guess, being a little bit more creative in that way than maybe most engineers. But my first job out of college was working as a biomedical engineer, which is how I got interested in medicine.
Mm.
So I was kind of a late bloomer coming to medicine, if you will. But I just thought it would be fun to actually come up with the ideas for products and things like that, as opposed to what most engineers do is build things for other people. And then in medicine, when you decide on what your specialty is, there's kind of a V in the road, if you will. You're either in a surgical or non surgical specialty. And I think because I'd always worked with my hands and interest in devices and things like that, I gravitated towards surgical specialties. But I also still had that more creative, artistic interest. And medicine in general is not particularly creative, if you will.
Mm. Mm-hmm.
But I think that's how I ended up in plastic surgery,
Mm-hmm.
is it combined all of my interests professionally. But from that is kind of how I got interested in the wellness side of it, as because as a surgeon, I felt that, what makes me happy is having happy patients.
Mm.
And what many, I think, of probably the people that you come in contact with that are in the wellness world is when you get people healthy, they're happy
Mm-hmm.
and they're
Mm-hmm.
grateful for, being able to work with somebody that helps to get them there. And so, of course, as a surgeon, we want to optimize our patients and their surgical outcomes and whatnot. And I think as a surgeon, we always look at ourselves as what is it that we did wrong or what is it that we could have done to make things better. But we don't really talk or in medical school learn a lot about, well, how do you optimize your patient? Like, how do you get a
Yeah.
patient in good condition, ready to recover from something traumatic like a surgical procedure? And, when you look at both sides of it, it's really optimization. How do you help everybody bring their best to the table? And I think that that's really how I got interested in our practice, got interested in really supporting our patients in a more holistic way. And there's a whole world out there of opportunity.
So you started with mechanical engineering
Hmm.
and then art design.
Right.
Was this all at
Hmm.
Stanford?
Hmm. Yes.
And you patented a medical device before going into medicine.
Right. Yeah. So the surgeon that I worked with is really an inventor and a very smart businessman and all of that. And he designed the first balloon catheter ever. And that opened up a whole world of catheters and, like less invasive interventional procedures.
Mm-hmm.
So I had the opportunity to work as part of his kind of pet engineering group for his pet projects, again, which is kind of how I got interested in medicine. But that's where the patent came from, is in a certain type of catheter.
Oh,
But yeah,
interesting. So he invented the balloon catheter, and then you had some type of support of that.
right,
Oh, wow.
exactly. Yeah.
And were you already inspired to go down a medical route, or did that bring you farther into it?
Yeah, I think just that whole interest in knowing more about what we were designing, who we were designing for, seeing more opportunities for products was kind of how I got interested in medicine. I don't really do that now,
Mm-hmm.
but that's just kind of my entry into the medical field because I wasn't, I hadn't taken the basic classes like organic chemistry and biology and things like that as an engineer. So that was something I went back and got the prerequisite classes to be able to apply to medical school.
And what a unique blend of engineering, art, medicine, and you found your path through plastic surgery to incorporate all three of those.
Right. I think, I guess with many things, I think most of us, if we look back on the different things that we've had the opportunity to participate in or learn through and whatnot, I think it just helps to make you a bigger, more whole person, the more
Mm-hmm.
experience that you have. And,
Mm-hmm.
you had mentioned traveling and, just the exposure to different things. I think it just allows you to bring more resources to the table and more different perspectives.
Mm-hmm.
And it's kind of interesting in that I think a lot of people look at plastic surgery as being very maybe superficial. It's
Mm-hmm.
looking how do
It's
you
in the name,
look and
plastic.
right. And so it, it's interesting in that because I mean, I did a lot of work in reconstructive surgery, trauma care
Mm-hmm.
for patients that have had traumatic injuries to their face and body parts and having their breasts removed for breast cancer and reconstruction.
Nothing superficial about any of that.
Yes, that's, I think, very true. And at the same time, a lot of that work is insurance based. So, when we talk about wellness, we're not so interested in the insurance based sick care model of caring for patients. And the thing that's interesting about plastic surgery, when you go into the cash based aesthetic side of plastic surgery, it frees you up from kind of being stuck in that world of, again, the insurance sick care model. And good or bad, I think unfortunately a lot of the wellness care still is very out of pocket and not insurance based because we're not talking necessarily about having a diagnosis that insurance covers. And I mean, being somewhat of a fee based model kind of frees us from being trapped by all of the constraints that insurance based care brings. And so, of course, I mean, we want to have insurance and the things that we're paying for in that way help to cover more of the prevention. And I think it's better than it used to be. And hopefully, at some point, the insurance companies will understand how much money it saves to be in more of a preventive mindset. But it's kind of interesting just that there is sort of that financial component that we all need to take into consideration in terms of how we care for people and the opportunities there are, just in, again, looking at things with a broader perspective.
And how does having a background in engineering and art influence your approach to, would you call it plastic surgery, what you're doing, or how would you describe your work?
Yeah, I mean, in our practice, there are three service lines, if you will. There's the plastic surgery work that I do. We do aesthetic work, which people are familiar with fillers and Botox and lasers and skincare and that type of thing. But Besana Health and Wellness is the wellness component of our practice. And I think having experiences some of these ways, for example, as an engineer, I feel like I'm very logical and very work in a very stepwise fashion and am very organized in terms of my approach to surgery and running a business. I think that the kind of art experience allows you to be a little bit more open-minded and creative in terms of the approach. So I don't think that I'm so rigid in my approach as an engineer that I'm not able to look at other ways of doing things. So I think it's that whole combination of, well, how do you approach surgery, or how do you approach wellness in a logical, organized fashion, but at the same time not do it in such a rigid way that you're not open to looking at other opportunities and other ways of caring for people, whether it's Eastern or Western medicine, or looking at homeopathic, non prescriptive ways to help patients, and looking at the whole body, the mind, spirit, just all the different components of what makes up a person. And they all contribute, to person's physiological stress and all of those types of things, and even cultural approaches. We try to meet patients where they are. Sometimes, just the U.S. American way doesn't necessarily fit with different people's mindsets culturally and whatnot. And I think being able to work collaboratively with a patient in a relationship, as opposed to it being me telling somebody what to do or how to do it, I think makes a really big difference, in what people are open to.
So you've been practicing now for about 20 years, and you've been recognized as a top doctor in Colorado for maybe 7 or more times I've seen. And who do you think you've had to be recognized as a top doctor in this kind of a way? My belief is the most doctors in this way are male. I wonder if that's true. So who have you had to be? Who have you become? Along this process to be recognized in this kind of a way.
Well, it's interesting in that I think some people look at it as kind of a popularity contest or something like that. The way that one gets selected is it's a survey among other physicians, and I think it takes a lot of trust to develop relationships among your peers and with patients, but also to develop a reputation of trust where other physicians really feel that you do right and do the right thing by the patients. Because I think as physicians, we're not always directly interacting with each other, and a lot of trust and reputation building comes from hearing what your patients have to say about other physicians. And one of the things that we're trying to do through our wellness collaborative is to establish closer relationships as practitioners amongst each other, so that we know each other personally and have that trust and ability to know how another person works and cares for patients. But some of it is again, doing right by the patient, such that, other physicians and caregivers have an understanding that patients are happy with you and trust you.
So having done this work, having done plastic surgery now for 20 years, how have you seen that industry evolve? How have you seen some of your practice and even mindset shift?
I think with kind of the whole wellness world growing, that I do see more plastic surgeons and other surgeons embracing more of a holistic approach. And I think, again, it's kind of hard to do it when you work in an insurance-based model, because there are only certain things that insurance will cover and that type of thing. But I do see in the plastic surgery world that there are more surgeons that are bringing more holistic practices into the work that they do and their approach toward patients. And I think that's only a good thing.
What's some of that base level holistic support that surgeons are starting to bring in?
What are they? Like
Yeah, what are you seeing?
yeah, I think some of it is looking at optimizing patients before surgery, making sure that, you've had a discussion about, well, what are people eating before, during, and after their procedures, bringing in homeopathic supplements like Arnica montana, for example, to reduce pain, bruising, swelling, just any of those types of things. I think people are really looking at, what are the smaller things that we can be doing to help give patients better outcomes.
Staying on homeopathic support, there's maybe a mindset that it's kind of woo-woo, that it's not effective. What are your thoughts on homeopathic care support?
I'm all for it, if you will. We recommend supplements to patients. We have them on protein powders and things after their surgeries. And so I think that a lot of it really makes a lot of sense. Like, if you have a surgical procedure, it's no different than your body experiencing a physiological trauma.
Yeah.
And so maybe another example might be that it used to be, you were NPO, right? You weren't supposed to eat or drink anything for 8 hours or whatever it was within the time of your surgery. And part of it was that the practical part of it was during the time, if you're going to sleep for surgery, they put a breathing tube down and they don't want you throwing up food and it ending up in your lungs and causing, a pneumonia or something. So they wanted your stomach empty.
Okay. Is that what NPO means?
Nothing per aura, nothing
Oh,
per your mouth, nothing.
okay.
But you could have clear liquids like water or something.
Mm-hmm.
But if you think about surgery maybe as like going into a sporting event, right? You wouldn't starve your and dehydrate your athletes before they go into a performance, right? A physical performance. So now we give clear liquids like cranberry juice or something so that you have some nutrition and sugar in your system before you go in for your event. So there are some things like that actually help people to recover faster and minimize things like nausea so that you can actually eat sooner after your surgical procedure. And so I think it's really looking at all of that whole experience with a little bit more of a critical mindset in terms of, well, how can you minimize the downside of not eating? Because, practically speaking, again, you don't want people with food in their stomach, but what are some other ways that you can support them nutritionally so that they're getting some calories and nutrition right before their procedure? And how do you prevent these problems such that they wouldn't be able to eat as soon as they might benefit and that type of thing? So it's really looking at it a little bit more of a detailed approach as opposed to just saying globally you shouldn't eat or drink anything within 8 hours of your surgery. So I think it's, there are a lot of those things like cars in a pit stop. How do you optimize all these different components to give your patients the best outcomes?
In other news, because of GMOs, monocropping, and soil depletion, Americans are not getting enough nutrients. That's why in 2018, I founded B Micro, the first freeze-dried microgreens company in the US to help Americans get more natural nutrition in their diets. Microgreens are a phase in the plant's life when they're just 14 days old and naturally the most concentrated in vitamins, minerals, and unique antioxidants. Our microgreens are all grown here in the US and certified USDA organic and regenerative organic. We grow, wash, and freeze-dry them to extend their shelf life from 1 week fresh to over 1 year, allowing us to ship anywhere in the US without the worry of spoilage. We have 2 flavors: broccoli, backed by over 2,000 studies on sulforaphane for its powerful detox benefits, and a blend of broccoli, radish, and red cabbage, our most powerful detox formula that we've tested, giving you the most bang for your buck. Easily sneak these into any meal: eggs, pizza, pasta, or even your kids' mac and cheese. We have whole leaf, powder, and capsule options, so you can choose the way that works best for you. Use code PLANT15 to save at bmicro.farm. I think of Hollywood sometimes when I think about plastic surgery, and some of the Hollywood actors, actresses, it looks like plastic surgery it appears quite unnatural, and I'm not like excited for them. I'm like, oh, good job on that. What might have happened there? Why might someone look, I don't know the word, bloated or just fake or just not, it just doesn't register as like, oh, I think that went good for you.
Right. So when people talk about plastic surgery, you mentioned the word plastic. People think of it as being fake or plastic. But plastic, the term actually comes from Greek and Latin origins, plastikos, meaning malleable. And that's really more referring to the skin the malleability of skin and the ability to take parts of the body, for example, to reconstruct other parts of the body. So sometimes we'll take tummy tissue and we'll make a new breast from it. That's really more the implication, I think, of the origins of plastics or plasticals. Plastic surgery is the malleability and the ability to shape and form the body as opposed to being plastic and fake, which of course, just to speak to your question, plastic has become very plastic, the plastic part of it. And, there are really, unfortunately for plastic surgeons, it's all the bad stuff, right? That is the marketing that people notice. And when it's done nicely and well and whatnot, you don't really notice so much. Like, the goal really is for people to maintain some youthful kind of vitality, to look natural and all of that. Unfortunately, I would say sometimes people get in under unskilled hands or techniques that aren't really the greatest. And surprisingly, as a plastic surgeon, sometimes people want to look fake, and I think as a surgeon to, who is the patient that you serve and, what is the population that you're comfortable with in terms of, giving the patient what they want versus something that you might, find a little bit more realistic or manageable or whatnot. Sometimes there's a little bit of a push me, pull you when it comes to, what people are looking for. But I would say when a patient is in the hands of a skilled surgeon who is, skilled at delivering, good results, that it can be hard to tell that patients have had work done. But there's certainly a lot of bad marketing, bad results because of, I think, not great surgical procedures out there. But that's more noticeable, of course, than patients that have had good results.
So I know people fly in from all around the country, the world, to come work with you. For those that maybe are not able to come and see you, what would you recommend when looking for a plastic surgeon? What are the top green flags, red flags?
Yeah, so, well, there's a certain bar in terms of proper training and certification. So, there is an American Board of Plastic Surgery that certifies trained plastic surgeons. There are fake boards out there, if you will, such as the American Board of Cosmetic Surgery, and that is not an official board of the medical society. So, unfortunately, it kind of gives you a fake certification, if you will, because those surgeons, sometimes they're trained as ENT surgeons and do amazing, great work in the face, but they're not technically trained to do work on the body. So you want to look for the stamp of approval from the American Board of Plastic Surgery, because then you know that the person is certified and trained by an official board and a medical board. And then I think sometimes it takes walking into the surgeon's office and seeing who you see working for the surgeon. If you see people working in the office that don't look like you would want to look, meaning overdone, not particularly natural, then maybe that's not the office for you. And it's always helpful to be able to talk to patients and their experiences, with a surgeon.
Who would you say the average patient is that's coming to you on more of like a cosmetic interest?
Yeah, I don't know that I could say that there is an average patient. I think when you hear plastic surgery, you sort of think of Hollywood and celebrities and people that are maybe a little bit over the top or whatnot. But you might be surprised how many grandmothers and daughters and mothers and aunties and uncles and grandfathers that have had plastic surgery. I think people that care about the way that they feel, that want to reflect how they feel on the inside, are all people that have had plastic surgery. And even things like, just looking tired, doing an upper eyelid lift can be really impactful, just so that people aren't asking you if you're tired or, haven't slept well or not feeling well
Yeah.
when you feel good on the inside. I think people want to reflect that same energy back when you look in the mirror. And that's almost anybody.
Is there an edge within our society, our culture today around plastic surgery on maybe younger and younger people going to getting work done?
I would say a lot of, I mean, patients are coming in younger, but I think it's more a sense of prevention, taking care of yourself early on. And I don't think that's a lot different than our wellness patients, who really are starting to understand nutrition or, looking at their labs and all of those types of things, really more approach from a preventive standpoint as opposed to, oh, I want to look better at a younger age kind of thing. I think most people are looking more for prevention as opposed to chasing, looking different or something like that.
What's like an entry level, like a light type of a procedure? You share about the eyelids. Is that what you said? Eyelid. What
An
did you?
eyelid lift.
Yeah, is that a tip? If you're like, okay, I'm looking to get a little something done. What might be like a light entry point for someone?
In terms of surgical procedures, that might be a good one. As far as, I mean, if you think about it, people notice your eyes. I mean, if you look tired and your eyes are kind of heavy and hooded and whatnot, and there's a lot of movement around the eyes. Excuse me, your peripheral vision is really important. So when you start to get the heaviness in your upper eyelids and you start to lose some of the peripheral vision, excuse me, I've had younger patients say that they thought that they were having problems with their night vision, and it wasn't really their night vision. It's just that you need as much light entering your pupils as possible, right, at night.
Yeah.
So if your eyelids are starting to cover, excuse me, if your eyelids are starting to cover your pupils, it's going to affect your night vision. Or if you start getting some heaviness in the upper lids, you're going to start activating your forehead muscles more, and that can cause problems with eye fatigue and tension headaches and more wrinkles in your forehead because you're activating those muscles trying to open your eyes up. And the skin is very thin in that area. So, and there's a lot of movement, you're blinking constantly. So, I would say that's an area that gets damaged, and wearing contact lenses can wear out some of the mechanism that helps you to keep your eyelids open. And so, all of those things can affect just, well, the mechanics and your vision, but also the aesthetics of your eyes. So, that is a common procedure that we do in the office, and it doesn't require you going to sleep under a general anesthesia, and the recovery patients tend to do really well with it. So I would say, that is a common earlier procedure that we're doing on patients. At the same time, even things like acne, helping younger patients control their acne, and just skin care procedures like facials and lasers to help improve the quality of the skin. Those are, I would say, entry level or early procedures. But like I said, even acne, so food is a huge part of and contributing to acne. And if you think about who gets it, it's the teenagers, and what are they eating?
Yeah.
Pizzas and gluten and sugar and
Yeah.
fast food and things like that. And that's a huge contribution to acne. And if you think about your skin as being the largest organ in your body, and the amount of inflammation that you see when you see acne flare-ups, I mean, think about what it's doing to your other organs if you have that much inflammation in your skin. And so just from a wellness standpoint, getting on top of it in terms of the education and regarding nutrition and the effects on your body with inflammation, those are all kind of early potential teaching points.
Yes, and I really want to get into Basana and all of the wellness side of everything. Um, Before we dive into that, can you give us a range, like pricing? What might somebody expect to pay for acne support or for an eyelid lift or whatever else is kind of a typical and more like entry?
Well, for example, our skincare consultations are all complimentary. And, that includes like an analysis of the skin, recommendations for products, suggestions for nutrition, and a referral to our wellness clinic Our consultations are anywhere from $125 to maybe a little bit more just for the consultation. Labs are more than that. I don't know that I could give you a price for the surgical procedures because it really kind of depends on each individual person in terms of how long we think that procedure is going to take.
Okay, so it's based on how the length of time that you're working
Yep,
on them.
usually on time. And if we're needing to get labs or like breast augmentation, there are implants involved and that type of thing. So, yeah, I wish I could give you a price, but it just kind of depends on each person.
Are there things that plastic surgeons used to do that you're just like, that I can't believe that that was part of our work 10, 20 years ago? Like putting silicone, or maybe there's other materials that were being put into the body where we're like, oh, we'll never put certain materials into the body. And some years ago it was commonplace.
I don't know that there is so much of that that was, kind of would be unheard of at this point. I think a lot of the technology has evolved and gotten better. And I mean, there are some procedures, for example, if somebody came in and said, oh, my lower eyelids are puffy, we would just take fat out. But what we've figured out is I think that we're better at analyzing the face. And sometimes it's not so much, for example, that the lower lids are puffy, but we've lost volume in the cheeks. And so now, it looks like you have puffy lids or that you have dark circles where you've lost volume. And in some instances, I would say, just going in and just removing fat from everybody's lower eyelids made things worse. If somebody's lower eyelids look sunken now, and that it's casting a shadow and all of that could make the situation worse. So I think in a lot of ways we've just gotten better at how we approach the face, for example, or analyzing what's happening in terms of the aging process. And so some of the techniques have changed, or the types of procedures that we're performing more or less often have also evolved, I think, just that we've gotten better at looking at patients.
And where does AI play a role in any of this?
It's such a new thing in terms of, well, for everybody, really. And I think it's probably going to play more and more of a part. But at the same time, I don't know that I could tell you right at this moment that there's anything profound that it's affected in terms of surgery and that type of thing. But I don't know that it's going to put surgeons out of business, but at the same time, I think that if you're a physician not using AI, you're going to be at a disadvantage. But I don't know that it's going to be completely replacing people at this point.
And for any surgeons listening, where might they start? Where might they start to lean into AI?
Oh, I mean, I think right now a lot of surgeons, or particular plastic surgeons, are using it more for marketing and that type of thing, as opposed to actual patient care. But certainly, like in the wellness component, just because people and physiology are so complex, that I think it's really going to help to support us in how we diagnose and treat patients.
So I just turned 40 in January, and I have just started doing collagen. I'm trying to find a good collagen to purchase, but grass fed, and there's some nice collagens seemingly out there that have clean labels. And then I put tallow on my face after I shower, and that's typically, and then try to stay hydrated and eat good and clean in that kind of a way. What might you suggest from like a skincare standpoint?
I think those are really good basic types of things. And if you like looking at it in terms of, well, what are the ingredients that your body needs to make collagen? Vitamin A, vitamin C, vitamin E, zinc, biotin, those types of things. So making sure that you're eating those green leafy vegetables and, all those things that make you healthy and help keep you healthy are really probably the same things that are going to support your skin. So again, just thinking about what are the ingredients that you need to make the collagen. And hormones are important as well. And so I think we had talked about this earlier when we were having our discussions, is that you need hormones for lots of different types of things. And so, for example, I have a friend who's a primary care doctor in Marin, And he says he can tell every single woman at a party who is doing hormone replacement therapy by looking at her skin, because estrogen is really important for skin. And so I mention that in terms of women, but men and women need estrogen, men and women need testosterone for the same cells and for a lot of the same reasons. Men tend to need more testosterone partly because they have more muscle mass, and testosterone is really important for maintaining muscle mass. But men and women's estrogen levels should run about the same to feel good and look good and maintain all your good, healthy bodily functions. And men just tend to need a little bit more testosterone than women do. But you need that for good bone health, brain health, heart health, skin health. And then I would say, as we get older, the issues with, just sun exposure, external damage to our extrinsic damage to our skin might warrant adding other things. So, for example, if you start to develop brown spots, well, arbutase is something that helps minimize pigment production. So that can be something helpful to add. Our skin tends to start to turn over more slowly. So there are products that can help your skin turn over more quickly. So you can imagine if the new healthy, yummy cells are bubbling up from the surface faster and you're shedding old dead skin cells faster, that's going to help your skin to look more plump and more youthful and better hydrated. And so I think that just trying to maintain good nutrition, maintain good youthful habits is helpful. But if you start to notice some other things that are cropping up, then there are products and procedures like lasers and things like that that can help to, reverse some of that aging.
Speaking of sun, what are the pros, the cons? What are the edges with sun exposure?
Well, people kind of understand that you need sun, right, for vitamin D and that type of thing. But even in Colorado, so we're looking at people's vitamin D levels all the time. And I would be hard pressed to find somebody whose vitamin D levels are sufficient to not need supplementation. And is that because we just don't get enough sun exposure? Is it because we're wearing so much sunscreen? I don't know that I know the answer to that. But even in Colorado, where we have so many sunny days and people are really out hiking, biking, and being active, I just have a hard time recalling any one person whose labs that I've looked at that have sufficient vitamin D levels without needing the supplementation. And so I don't know that I would say, okay, well, just don't wear your sunscreen and sit out in the sun for an hour every day. I don't know the number that people need to get adequate amounts of vitamin D production from the sun. But unfortunately, I see a lot of skin cancer. So it's like, how do you weigh that, the precancerous skin lesions and that type of thing that you get from sun exposure. So these days, I would almost say, I feel like most people need some supplemental vitamin D, and you're going to have to wear sunscreen, to prevent those skin cancers. So I don't know. I don't know the answer to that. Maybe
Yeah.
AI can answer that for us. I don't know.
What
But yeah.
do you recommend for vitamin D supplementation?
Well, I think it really depends on how you absorb. So, we definitely recommend at least a vitamin K2 and a D3 supplement, which a lot of people are starting to know more about K2, but vitamin K2 is not vitamin K, which can affect clotting and things like that. There is a vitamin K2, and what it does is it helps to pull calcium out of soft tissue, such as your atherosclerotic plaques, and put it into your bone and teeth where it belongs. And so, there's kind of like vitamin D being sprinkled everywhere, but people don't talk so much about the vitamin K2. So when you see like bright orange yolk and butter that's very yellow, that is the vitamin K2. So that's why grass-fed products are really helpful, because that's where you get the K2 is out of your, chickens that are eating grass and cows that are eating grass and producing milk and butter, is that you can see it in the color. So I don't know if you travel to other countries and you see the bright orange yolks and the bright yellow butter that you don't see so much here, or if you crack eggs that are grass fed organic next to your everyday eggs from
Yeah.
King Supers, you can see it in the color.
Yeah.
So, K2D3 combination is really important and helpful. And some of our supplements will have vitamin A in it as well. So I feel like I see lots of calcium everywhere. There's calcium in your orange juice, there's calcium supplementation in your milk. But my question is, if you're not getting your estrogen and testosterone and your vitamin K2, which helps you build nice healthy bone and get, like I said, the K2 helps you get the calcium out of your soft tissue and put it into your bone and teeth. Where is all that extra calcium going? I mean, are you depositing in your atherosclerotic plaques? Are you making more kidney stones? Like, where is all that extra calcium going if you don't have the mechanism by which to get it into your bone and teeth where it belongs? So, the problem, for example, with a lot of the what I call fake bone building medications, is that they will help you increase your bone density, right? People talk about bone density as being important, but bone is made of live, healthy cells. And so, a lot of what these fake bone builders do is, yes, it will increase your bone density because you get more calcium or cement into your bone, but some of them actually increase your fracture risk because you're creating more brittle bone. You're not making new healthy bone cells. And so, that's why doing it properly in terms of estrogen, testosterone, vitamin K2, D3, giving your body all the ingredients it needs to make new healthy bone cells is the way to decrease your fracture risk because you're making new healthy pliable bone. And you need estrogen and testosterone to make bone cells.
Are there any brands out there that you recommend for to start looking at some of these supplements?
Well, so we recommend products through Full Scripts. So
Mm.
Full Scripts is basically an online supplement clearinghouse, but their products are vetted
Mm.
and they're physician grade products. So I would say any of the products that you're getting through Full Scripts,
Mm-hmm.
regardless of the specific brand, I
Mm-hmm.
think you can rely on.
Mm-hmm. Any other supplements? You spoke to protein. Is there a certain type of protein? There's everything from pea protein to whey protein and lots in between.
Yeah, and I think some of that depends on you.
Mm.
Are you gluten sensitive? Are you, that type of thing? I think some of that comes into play in terms of like which products might be best for you. And
Mm-hmm.
some of them are really, tailored for just depending on kind of what you're looking for in terms of the ingredients. So some of that is pretty personalized, I would
Okay.
say. But in terms of, again, like looking to Full Scripts for generally good quality protein products is a good place to start. But each individual person might be looking for something a little bit different.
What about doing an assessment on me? Where do you think I'm at with my mm, uh, with how I'm presenting right now?
Well, I think just going by your age,
Mm-hmm.
so you're pretty lean. You don't look like you have a lot of visceral fat, which can
Mm-hmm.
imply that you don't have a lot of inflammation or you're not tending toward prediabetes or metabolic syndrome. But just knowing your age, we should probably look at your estrogen and testosterone levels
Testosterone I just
and
got
things like that.
just got today, and I'm at 800. But estrogen I was not tested for.
Yeah, and so I would say that's not uncommon for men to not get tested. Well,
Yeah.
women don't get tested for estrogen and
Yeah.
testosterone.
Mm-hmm.
But I would say even at a level of 800, that it's probably a little bit low.
Mm-hmm.
And so when we look at labs, we look for optimization, meaning it's interesting how people look at labs. So you might go to Quest or LabCorp and get your lab drawn,
Mm-hmm.
and you might be smack dab in the middle of quote unquote normal.
Yeah.
And
Right.
so that is very misleading
Yeah.
because I don't know how many of your guests out there are familiar with statistics or even just the concept of what normal means. So when you look at a bell curve, that's what people are looking at in terms of, what is the distribution of most numbers. And so if you look at a bell curve, it means that 95% of whatever numbers that you're looking at are under that curve. So let's look at the average weight in this country. So if you put 95% of numbers for a male of your age under there in the United States, if you looked at what the number right in the middle of that normal bell curve is, you would be overweight, right? So it doesn't mean the bell curve doesn't tell us that something is good or bad. It just tells us that 95% of numbers are under there. So if you look at the middle of 95% of numbers that are under there for a male of your age in the United States, that number is going to be too high because most men of your age are too heavy
I see.
in this country. So it's already skewed in a bad direction. It doesn't tell us that it's a healthy weight. It just tells you that 95% of the numbers are under that curve. So, first of all, well, where do we think our quote unquote normal lab values come from for blood labs? Well, it comes from sampling the general population and getting that average number, meaning creating a bell curve or that quote unquote normal curve for testosterone, for estrogen, for
Wow.
vitamin D, for cholesterol, for triglycerides. So the curve doesn't tell us if it's a good number. It just tells us where
Wow.
most other people's numbers are in there. And so what we're looking at is optimization. What is a good number on an absolute scale, and what is it for you? And so let's give an example of estrogen. So if you look at Serena Williams, she has a lot of muscle mass. So she's going to be more testosterone dominant. If you look at Bette Midler, she's more curvaceous, right? She's going to be more estrogen dominant. So if you switched the testosterone levels and the estrogen levels for those two individuals, they would not feel good and be happy. And so what we're looking at is, what is a good number on an absolute scale, and what's a good number that's going to be good for you? Like, what is a number that you feel good at? And so just lab interpretation makes a big difference.
The labs that I just got back is like, hey, you're great on everything. And it makes me feel good. But now hearing that, hey, this is based on the general population
Right.
that it's comparing me against. I could see where there can be a lot more room for improvement for me.
Yes, and 800 is not a bad number, but I have in the clinic a graph, and it looks at testosterone in men. So if your level is 900, you're already at risk for dementia at a level of even 900. So we like to see our male testosterone levels above 1100.
Yeah.
So and I just looked this up because I knew we were going to be having this discussion. So
Thank you.
if you look up Quest quote unquote normal lab values for male testosterone, and this is not given a particular age, this is just saying men, that it's something like 245 to 1100 is the spread. And so if you look at the middle of that, that's 425 or something like that. So if you were to walk into a physician's office and your testosterone levels, your total testosterone levels were showing 425 nanograms per deciliter, they would say it's perfect. It's
Yeah,
right in
nice
the
job.
middle of normal.
Wow.
But you're already at risk of aggressive prostate cancer at that level. You're at risk of dementia. You're at risk of dying. You're at risk of a heart attack with a level of 400. So let's ask this question. So what other lab value would you say, like looking at somebody's sugar, if the lab told you it was critical and you were already at risk of dying, then would you tell a person, oh, let's just check your sugar again in 6 months or in a year? Because it's within normal when you're already at risk of dying with that number being that low. So that's what we do with the testosterone. We're like, well, let's just follow it. It's trending down, but it's within normal limits. Well, I have a graph that tells you you're already at risk of mortality
Yeah.
with a level of testosterone that low.
Yeah.
I mean, for a lab for glucose or something like that, you would get a critical alert as a physician from that lab for that number being that low. But we find it's perfectly acceptable that number. So it's, it's one of those things we just haven't been paying attention, to these things. Or, I mean, if you go in for annual labs, you would normally not get your testosterone estrogen levels checked.
Yeah, I had a special request.
Yes. And I would say for most labs, like what we call a CMP or a comprehensive metabolic panel or your electrolytes or that type of thing, I mean, most of those numbers are going to be normal unless you're dying. And so the things that we look at when we're looking at more functional labs is we're looking at a bigger picture in terms of hormones, what do some of your genetics look like, really diving into your thyroid and things like that. So it's different going into a clinic that is looking at it in more of an integrative or functional approach.
And what's some of the low-hanging fruit someone might do? What might I do to get myself from 800 to 1100 testosterone?
Well, there are some more homeopathic supplements that you can take. DIM, which is, when people talk about, just eat a lot of broccoli and you won't get breast cancer. Well, DIM and sulforaphane are things that you find in cruciferous vegetables, but they help in many, many ways in terms of increasing your hormone levels, improving the metabolic breakdown products. So when your hormones break down, there are different byproducts that they turn into. And there is a good pathway of metabolic breakdown and there's a bad pathway. The bad pathway increases the risk potentially of, say, breast cancer and that type of thing. So the DIM, for example, helps to increase the percentage of good breakdown products. It increases how much free testosterone is available. So there's something called sex hormone binding globulin. It's a molecule that acts like a taxi cab that testosterone attaches to. So you want a lot of free testosterone, meaning you don't want your testosterone riding around on this SHBG or sex hormone binding globulin taxi cab because it's not doing any work. So the DIM helps to increase free testosterone, decreases the number of taxi cabs or the SHBG molecules, so you have more free testosterone. So it does many things. So even taking a supplement like DIM can be really helpful for both men and women. So there's those types of things that you could be doing.
We at B Micro, we do lab tests for DIM, and part of my understanding is DIM can also support with estrogen, that there's a good and bad estrogen. And would you share more on that?
Yes, so it's kind of the same thing. Is that testosterone? Well, estrogen has breakdown products, as do testosterone, so it helps with both.
Okay.
And there's a book called All About DIM. It's about this big, and every paragraph addresses another process that DIM is helpful for. So there's a whole book on all the different things that DIM can help with.
I think this is a good time for me to gift you one of my products here. We've got a blend of microgreens.
Terrific.
And so we have broccoli, radish, and red cabbage, and we lab test for a wide variety of things. But what's most interesting to me is NRF2 activation. And that's why a lot of people want sulforaphane, is for that NRF2 activation. And in this blend, it activates, our lab tests show that it activates it about 3 times as powerfully as just broccoli on its own. Why? I'm not quite sure, but the cruciferous have that ability, and maybe there's some type of an entourage. We don't quite know, but we've just kind of lab tested a bunch until we found this ratio that was good in that way. Can you speak to sulforaphane, NRF2 activation, sprouts and microgreens anymore?
Well, I would say, I mean, I haven't studied it to the extent that you have and whatnot, but I think the best place to get these things is through food. And again, maybe you've tested some of these things in a little bit more in depth, but I feel like that's always the best way to get your vitamins and minerals and all of that is through whole foods. But as many of us know, it's just the soils that we're growing foods in and all of
Yeah.
that are just not, or even vegetables and fruits that we're buying in the grocery store have been on the truck for a week, before they get
And
to us.
losing nutrients every day.
And so it's really hard to I think get things through the food, which is where your
Freeze dried.
microgreens and all of that are really fantastic. Again, I haven't tested and whatnot, and not as knowledgeable about those types of things, but I think really finding good nutritive food sources are really the best way to get any of our nutrients.
And what does self-care look like for you? What are you eating? What does movement look like? What are some of your daily practices?
Well, I think I'm a good example in that I'm not perfect by any means. I don't smoke, I don't drink, I don't do drugs, but I love sugar. I hadn't worked out for many years. I mean, I competed competitively in high school kind of thing and had worked out pretty regularly, but with work and kids, family, all those types of things, there's a lot of self-neglect. And, I've really just started to try to be better about all these things. And embarrassingly, there was a time when I said, well, I didn't really eat anything unless it came out of a plastic container or a plastic packaging, during my training and whatnot. But at that point, I just didn't know. We
Yeah.
didn't learn about nutrition in medical school, sadly, very
Yeah.
sadly enough. But so I'm definitely better than I used to be, cooking more and being more attentive to reading labels. And I just found one of our nurse practitioners showed me an app where you can scan the QR code and it gives you a 0 to 100 rating on on that particular product. So again, embarrassingly, I did have some Girl Scout Thin Mints. They rated a number 2 on a scale of
Yeah.
0 to 100.
But 10 on enjoyment.
Yes, so there is that component.
Temporary enjoyment, very high.
And but even scanning different types of coconut milks or whatever, with the additives and whatnot. I mean, we have these tools now that are instantaneous. Like you're not even having to read the label, right, to get in kind of an instant read on your foods and whatnot. So it's really kind of incorporating all these things, taking advantage of these things that are out there, to just help to nudge us right in a good direction. So, like I said, I'm not perfect, but I'm certainly better and more aware, and than I was, when I first started training and all of that.
Well, you come across as vibrant, energetic, very like clear and present, and I'm just wondering what else might be there. How are you showing up in this kind of a way?
Well, I think the hormone part is a huge component. So I have dementia on my mother's side of the family. I don't know that much about my father's or my grandmother's, my maternal line. I know grandmother, great grandmother, mother with dementia. And I'm 63 now. And when I was in my probably late 30s, early 40s, every time I would forget something when I walked into the room, I would wonder if it was starting.
Oh, wow.
I mean, it's, you think, okay, is this like the first sign? And I also remember sitting on the edge of my bed one day feeling like I had the creakies, meaning, I was starting to feel like I needed to get up out of bed a little bit more slowly because I might pull something.
Yeah.
And I would say that I don't know that I really have those fears at this point, 20 years later. And the hormone component, I think, was a really huge factor. People talk about dementia as being type 3 diabetes. And for a long time as a physician, I didn't really understand what was meant by that. But what happens what happens with diabetes, you have plenty of sugar in your system, right? It's circulating in your bloodstream. But the sugar is not getting into the cells because maybe your insulin isn't working as well, or the ignition switch that the insulin key fits into is not working as well. So your insulin levels go up and your sugar levels go up in your blood because your body is trying to overcome the fact that the turn on ignition is not working well, or your receptors not working well. So the reason that keto diets are as effective as they are is that your body's first source of fuel is sugar. And when your cells aren't getting the sugar, it looks for something else to burn, and it burns fat and muscle, which is why you lose fat when you go on a keto diet. So if you think about the same process in your brain, if the sugar is not getting into the brain cells, it's going to look for something else to burn. And your entire brain is basically made of fat. So you are literally burning or eating your own brain when you have diabetes in your brain. And so insulin, estrogen, testosterone, they all help to get the sugar into the cells. And so if your insulin's not working well, or you don't have estrogen and testosterone to help get the sugar into the cells, your body starts to eat its own brain because it's made of fat.
Wow.
So if you look at some of the clinical examples of this, so women tend to develop dementia more often than earlier than men, because when they go through menopause, they lose their estrogen and testosterone. And so then the sugar's not getting into the cells. And so women tend to develop dementia earlier because we go through menopause and we lose our hormones, and more often. So if men make estrogen from their testosterone, and even if men's testosterone levels are low, they still have estrogen and testosterone. So that's why they tend to develop dementia less often and later than women. And so you can see it clinically in terms of one of the implications of low hormones. So we kind of talked about how important it is for making bone cells, but you need it for proper brain function as well.
When I think hormones, I also think birth control. How does birth control affect women's hormones?
I think it depends. I wish I could speak in more detail to that. I'm not a gynecologist, but part of the problem is that a lot of birth control contains a synthetic artificial progestin, which can linger in the body for a very long time because it's not an organic molecule that your body recognizes. So it can be harder for it to break down. So it can persist in your body for a long time. But it was the progestin that caused a lot of the problems that they saw in the Women's Health Initiative study. So there was a study, WHI, that's well known in medical circles. What they thought were the implications of that study were on the cover of Time magazine in 2002. So almost overnight, well, the study said basically we have to stop giving hormones to our women because it's killing them. Women are dying of heart disease. Women are dying of clots and strokes. Women are dying of breast cancer because of hormone therapy. Well, what they didn't talk about was the fact that the hormones that they studied were artificial synthetic hormones, and they weren't human identical hormones. And for decades, people said that they were the same and they were interchangeable. Well, a lot of the bad things that were happening actually were happening from the progestin, which was the artificial synthetic progesterone, which is one of the prime ingredients that you see in a lot of birth control. So there are implications from taking hormones for many years. And that's something I think that young women have to consider as they select their form of birth control. I mean, becoming pregnant has a lot of implications if you don't want to be pregnant. So, of course, we need our birth control, but I think we need to be very selective in terms of what young women are choosing in the direction they're going with their birth control.
This podcast is brought to you by B Micro, organic freeze-dried microgreens for easy, everyday nutrition. Sprinkle them on any meal and enjoy the benefits. Shop now at bmicro.farm and use PLANT15 to save 15% off your next order. If someone's going to their primary care doctor and getting their once-a-year panels done, what might they ask for or inquire about outside of the normal testing? I'm hearing testosterone, estrogen, maybe vitamin D is a normal one.
Looking at vitamin D, looking at something like homocysteine, which is an indicator. Well, homocysteine is an amino acid, but it can be indicative of levels of inflammation. It can also indicate that you have a genetic issue with your methyl tetrahydrofolate enzyme. So one of the things that does is it activates B12. And so many people either only have half the gene to produce that enzyme, or they don't have the gene at all. So that means that, and B12 is a very important metabolic vitamin. It plays a part in a lot of processes in the body. And if you don't activate it by adding a chemical group called a methyl onto your B12, it doesn't activate your B12. So all it takes is taking methylcobalamin, meaning B12 that's already got this methyl molecule attached, so your body doesn't have to do it. And many of the functions, enzymatic functions in your body will be fine. But that's something that could be tested at birth, like testing for the MTHFR gene. But in your normal lab values, if your homocysteine levels are high, that can be one indicator that you have an issue with lacking that gene. So you can imagine if you test all infants for this MTHFR gene when they're born, you just start supplementing them with their methylcobalamin vitamin, and you can imagine that it's going to prevent a lot of problems down the road. But I don't think that insurance covers it, and it's probably under a $30 test. But because insurance doesn't cover it, people don't get it.
Yeah.
But they don't ask how important it is and how much it costs.
There's all these words that we've never heard of before. It's
So
like, how should I know to ask for this?
ask
I've
for
never
these
even heard of
things.
any of this.
Yeah, and I guess that's where it's helpful to go to an integrative or functional practitioner. Is there's some just basic tests that are inexpensive. So many of them only need to be done once. Looking at the labs in a little bit of a different perspective, like we talked about. I don't know that we ever use the word normal so much in our practice, unless we're kind of poo-pooing the word normal. But what's optimal and best for you. It's kind of looking at all of those things. But that's where that's the advantage of a functional or integrative practitioner, is that that's the perspective that they take when they look at you.
Yeah. Any other tests that you're recommending?
I would say those are the biggest ones. I mean, we use, and with AI, this is going to become more prevalent, but we use a system called Optimal DX. So we download all of your labs into this analysis system. And,
Years and years worth.
we can. But what it does is it looks at your labs in a more organ-based and holistic pattern recognition way, meaning, sometimes you'll get your labs values back and it'll say, oh, your testosterone is low, or your glucose is high, or your whatever is low. And we, at least historically, as physicians, used to tend to look at those labs in isolation. Your cholesterol is high, so that's bad. This is low, so it's good. But what this system does, and I think what AI is going to really be doing, is taking all of your numbers into consideration and looking at it in terms of pattern recognition. So this is high, this is low, this is low. That means this. This is low, this is high, this is normal. That means this. And so our Optimal DX system gives to our patients an analysis that's organ-based. So it'll look at your cardiovascular system, it'll look at your immune system, it'll look at your liver and all of that. And really comment on how your organs or systems are doing by looking at all of those numbers as a whole. So it's a much more comprehensive analysis of your labs.
And I'm forgetting the word, but is it thyroid that you put a lot of focus and attention on as well?
Yes. And so I feel that the thyroid is really not treated properly in this country.
First, what is the
so-
thyroid, please?
Yeah, so the thyroid is a gland that sits right here in the middle of your neck, and it controls your metabolism. So probably every cell in your body is affected by thyroid hormone, so it's really important. And just for a quick thyroid lesson. So if we look at the palm of my hand as being the thyroid molecule, the most active form of thyroid molecule is called T3, meaning it has 3 iodines attached. So iodine is really important. And I feel like iodine supplementation, particularly for people in this country, is really important because we're not in Japan eating, seaweed and kelp every day. So where are we getting our iodine? Because that's where it comes from. So T3, or liothyronine, is the most active form of thyroid. When patients are diagnosed with low thyroid, most get T4, which is the thyroid molecule with 4 iodines attached, meaning there's a trade name for it called Synthroid. So I would say the vast majority of patients that are being treated for thyroid that come through our office are only taking T4. So we consider this a pro-hormone, meaning your body needs to pluck an iodine off to activate it into the more active form of thyroid. And so the problem with just getting the Synthroid or the T4 is that your body thinks, oh, I have plenty of the pro hormone, so I don't need to make more pro hormone. I don't need to make the active form of thyroid, which is the T3, and I don't need to activate the pro hormone T4. I don't need to pluck an iodine off to make T3. So what you're actually doing is creating a negative feedback loop to whatever your own thyroid is actually still making. So it's detrimental to only take T4. So we recommend taking something called NP thyroid or Armor thyroid because it's actually ground up pig thyroid, but it comes with the correct ratio of T4 to T3. There's also T2 and T1, which we don't know exactly what that does, but also has calcitonin in it, which helps to regulate your calcium. So it doesn't cause or create that negative feedback loop, and now you're getting the correct ratio of all the different types of the thyroid that you need. And I would say many of our patients that are being treated outside of the integrative or functional world will come in with either only what's called their TSH or their T4 levels checked. To me, those are probably the lesser numbers that we need to know because as I said, the T3 is the most active form. So we need to know what your T3 level is.
Okay.
And there's something called reverse T3. So you know those keys in your lock or in your drawer that fit in the lock, but they don't do anything? Well, so if your reverse T3 looks like this, meaning it's got 3 iodines attached, so it looks like the T3, but it's one of those keys that fits into the metabolic lock that blocks it. So that's how your body downregulates its metabolism. So you can imagine if you're dieting and your body doesn't think you need to be dieting, or if you have some disease process where your body's trying to reduce its metabolism, it's trying to conserve energy, it's going to make a lot of reverse T3 because that's how it slows your metabolism down.
Wow.
So if you start dieting, for example, oftentimes you'll lose weight for the first 28 to 30 days, but then your body's like, okay, now we're losing weight. What's happening? That's not supposed to be happening. It will start to make more reverse T3 to slow its metabolism down. So you might be starving yourself and exercising and not losing weight, which tends to happen about 30 days out. That's because your body's making reverse T3 to slow its metabolism down. And so you have to figure out, like with anything, why is your body gaining weight? Well, a lot of times it's because it's trying to make more estrogen because fat cells
Wow.
make estrogen. So if you start to externally actively try to counteract this process your body's doing, like gaining weight, for example, to make estrogen, then it's going to slow its metabolism down by making the reverse T3. So in my mind, knowing your T3 levels and your reverse T3 levels is more important than knowing what your T4 level is. And the TSH is the thyroid stimulating hormone, which is made in the pituitary gland in your brain. It tells your body to make more thyroid if the thyroid levels are low. But that's so many steps removed from the actual number that we need to know. So which labs that we're checking is also important, particularly in terms of managing the thyroid.
And so those labs are the thyroid T3 and the
Reverse
reverse T3.
T3.
Okay.
If I was given the choice of only selecting 2 thyroid labs, those would be the 2 numbers that I would want to know.
Wow. And can you share what does a healthy person look like, or what does life look like for someone that has a balanced thyroid?
Well, you don't have the symptoms of having low thyroid, meaning what tends to happen if your thyroid is not functioning optimally is that you'll have cold hands or cold feet, or you'll be the one that's always cold in a room, or your skin will be dry, or you're gaining weight, or you're tired or feeling lethargic, or your nails won't be growing, or they'll be dry and brittle. Your hair will be dry and brittle, or it won't grow, or you're losing hair. So these are all things, right, that your body finds expendable. It's not going to be putting resources toward these things if it's conserving its energy for other bodily functions. And so it's kind of those types of symptoms is, just signs that your metabolism is slowing down.
What are some of the things that are bad for our thyroid?
I don't know that I could come up with off of the top of my head, like, don't eat this, don't eat that. But particularly, well, gluten can be bad, particularly for patients that have Hashimoto's or we already have a diagnosis of autoimmune thyroid. And so, what tends to happen is that there's similarities between the gluten molecule and what your body attacks in your own thyroid if you have Hashimoto's autoimmune thyroid. So people say it's like throwing gasoline on the fire. So if you're eating a lot of gluten, it can exacerbate your Hashimoto's where your body's attacking its own thyroid. And so, kind of along those lines, reducing your gluten intake in general is probably helpful, particularly, in this country. And so I
Because
think
of
that's
all of the glyphosate and things on our gluten, or
that, but even the gluten molecule itself, yeah. And so I would say that's one big one
why
for
do you think so
sure.
many people are intolerant to gluten and to dairy today?
Well, some of it is just the way that our food is made here. There are people that, can go to Europe and eat gluten and dairy and not have a problem. So, part of it is just the way we process our foods and all of that, I think, here. I think that's a big
Yeah.
component of it.
Mm-hmm.
Yeah.
So what does hormone therapy look like, and what can happen if you aren't doing hormone therapy and you need it?
So, all of the things that go bad as we get older, so hip fractures, dementia, heart disease, clogged arteries, high blood pressure, diabetes, prediabetes, all of those things are the problems of not doing hormone therapy because your body's lacking some big ingredients that it needs to do the work.
Hmm.
And so you can't make bone without estrogen and testosterone. You can't get sugar into your brain cells without estrogen and testosterone. I would say the top three things that the cardiologist wants in good cardiovascular health comes from testosterone, meaning increased contractility of the heart. It's one giant muscle. You need testosterone to make muscle work. It helps to keep the inside lining of your blood vessels clean, and it helps to relax the blood vessels. So testosterone is a natural vasodilator or blood pressure cure. But all of those things don't happen if you don't have your estrogen and testosterone. And so the question is not what are the complications from doing hormone therapy, is what are the complications of not doing hormone therapy. And it used to be without antibiotics, we lived till we were 40 or 50. But now we live, just with the advent of antibiotics, we live into our 70s, 80s, and 90s. So half of our life is spent without our hormones. So to me, it's a quality of life issue. Like maybe this is kind of trivial, but as we get older, we lose our near vision, right? So we wear glasses. Well, you wear glasses to improve your quality of life. So part of it is not just the health, but also your quality of life. And what happens if you have a hip fracture and you can't live independently anymore, or you develop dementia and you're drooling in a wheelchair in the corner? Like, if you're not doing it for yourself, who's taking care of you when these things happen? Either you're a burden on your family or you're a burden on society with your ill health in that later half of life. So the idea is to square off the curve, right? So if we just do like we do in the US, where you get the dwindles and your health starts to suffer, you're paying more and more money for all of your woes and, for your Alzheimer's home or whatever, and then you get tortured by the US healthcare system and then you finally die. What you want is you want to live a healthy life and then all of a sudden not wake up one day,
Yeah, right.
on a square off the
Yeah.
curve. So, so that's one thing. I mean, in terms of like dying or whatever, aging naturally is I mean, not doing anything to help with the quality of your life and maintaining your health. Because the reality is that we're all living longer. So, what does that look like during that time?
Yeah, you want to be healthy for those as many years as you can.
Right.
Did we speak to hormone tests? Is there a certain type of hormone test that people can look to
It's
get?
more just getting them looked at.
Okay, and
Yeah.
there's many. Would you speak more to maybe
Um,
just hormones and testing for them?
yeah, I mean, initially just getting your estrogen and testosterone levels
Okay,
checked.
those are hormones. Excuse me. Okay,
Yeah,
okay.
just getting those levels checked.
Cool. And is there an age where you really think that for men and women, and maybe they're different ages, really start paying attention?
Well, if certainly if you feel symptomatically at all, sometimes patients will come in and they'll say, I feel great. I feel really great. And, they're postmenopausal or something, At that point, I mean, I feel like even age wise, or if women are perimenopausal, or again with men feeling a little bit symptomatic, that you should get checked. Because I'll give you a couple examples. One is that if you look at women and their bone density starts to drop in their late 20s and early 30s. Why is that? Well, our hormone levels are starting to drop in our late 20s and early 30s. So that's actually when the levels start to drop. And I had a patient, she was 26, and we have a symptom survey that we ask all of our patients, regardless of age. How do you sleep? Do you feel anxious? Do you have depression? Are you tired? Do you have muscle ache, joint pain? All of these different symptoms. And when I looked at her symptom survey, she looked like an 80-year-old woman. And she's 26. I go into the room, she's this smiling, boppy, blonde 26-year-old. And I said, do you really feel like this? I mean, it says you feel exhausted. And she's like, no, I do. Because when I come home from work, I try to go to bed as early as possible. And I can still be exhausted after 10 hours of sleep. That is not normal. And I said, well, have you told any of your doctors about this? And have you ever had your hormones checked? And she said, I told my doctors, but they asked me if I'm menstruating regularly. And I said, yes. And they said, well, we don't need to check your hormones because they're fine. I said, well, you don't know unless you checked, and you're
Yeah.
very symptomatic.
Yeah.
And so we checked, and everything was low. Her thyroid was low, her vitamin D was low, her B12, her testosterone, she looked like, her labs looked like an 80-year-old woman. But just because she looks like a 26-year-old, and she's menstruating normally, then nobody bothered to check.
Wow.
And so, it's really important to. To the patient.
What would you say the state of the U.S. medical system is? How are we trending in a certain direction? Are there things you're optimistic about? What's the state of the union for the U.S. medical system?
Well, I think we're still very mired in the insurance-based sick care model, and I think there are a number of reasons for that. And at the same time, I feel very hopeful because people do have Dr. Google. I mean, it's not always great for physicians, but at the same time, patients are more engaged, they're better educated, and I think the medical community itself is frustrated with the state of things. And for example, like some of the training programs that help physicians to transition into more integrative and functional care, those training programs are growing. And that just tells me that, even we as physicians are more and more frustrated with the state of affairs, and we're looking to move the needle, in a better direction, and we're looking to educate ourselves. But at the same time, the whole system, I mean, we as patients and physicians have been trained is based on insurance. What will insurance cover? We have to get out of that mindset. But I think because insurance care is so expensive that we kind of, as customers, expect everything to be free, right? Or I'm not going to do it unless insurance covers it because I spent so much on my insurance premiums and my deductibles and copays and all of that, as opposed to saying, well, how much is it really if I pay cash, for a test that my physician and I feel like I need, Let's just think outside of that system and understand how much money we can ultimately save by prevention. But I think we're so mired in this insurance based mindset, it's hard to get out of it. And I mean, if you think about, like your car insurance, well, you don't expect it to pay for your windshield wiper fluid and your oil changes because we understand that the insurance is for a big accident or something, right? A
Mm-hmm.
big ticket item. And that's really what health insurance is, but we just pay so much for it that we feel like it should cover more things than it does.
Mm-hmm.
Yeah, and there's just so many middle people. I mean, if you think about how much we could save just going to a cash-based system, you're cutting out so much expense of like all the processing and all of the in-between stuff that's not paying for actual care.
Yeah, where is the money going in today's medical system? Where do you see the waste, the bloat, the fat?
Yeah, well, there's, I haven't looked recently, but it's like 90% or some huge number that goes into everything that's not all the extracurricular, that's not actually, what's required to care for the patient.
And what about the students, the people that are training to be doctors now? What's the state of their education? You reference how you didn't get any holistic or wellness health type of training.
Well, there are medical schools, I think, that now incorporate some nutritional training for their physician, medical students and whatnot. So things are moving a little bit. But so, for example, the FDA just had a hearing on menopause and women's access to hormones
Hmm.
July 17th, I think it was, of 2025. And they talked about a lot of the things that I'm talking about, like how important hormone access is to our women patients, and it's true for men as well. But that's not what we're learning in medical school. Like there's a certain curriculum, right, that's being taught, and it's something like 15 years before a new idea gets actually incorporated into clinical
Wow.
use. So it might be a new discovery for cancer or whatever it is. It takes 15 years for it to get implemented because now they have to start teaching it in the schools and it has to start getting into the
Yeah.
curriculum. And so I feel like it's still slow, but that's where, again, Dr. Google, AI, patients being their own advocates, opening lines of communication between patients and their practitioners, all of those things I hope are going to help to accelerate this.
Is there any leadership in at a federal level that you are excited about? Is there anybody that's really, on that has the American health coming at it in like a benevolent way, with the really trying to do a good job for the Americans' health?
Well, I don't know
Yeah.
the answer to that. I
Okay.
mean, I think with the current administration, there are efforts to shake things up,
Hmm.
but I think there are both good and bad sides to the way it's being done. I think those in the integrative functional world are hoping that some of the regulatory stuff is going to relax a little bit
Hmm.
and whatnot, but it just seems like politically there are so many extremes that right now it's hard
Yeah.
to find a balance.
Yeah.
So,
Speaking to Dr. Google, I had cut my finger about a year ago and ended up getting 7 stitches.
mhm.
And I went to Dr. Google because I hadn't gotten a tetanus shot in like 10 years. And I convinced myself that I had tetanus. And I was like, I'm going to seize up and like just turn it, like when you get tetanus, it's bad. And then I went to the doctor and he's like, Dr. Google is really good for my business because it just freaks people out. And he's like, I've been a doctor for, he was about to retire. Maybe he was close to 70. He's like, I've been a doctor for a long time. And he's like, I don't think I've ever seen somebody get tetanus. How do you think about that, where people might be able to get themselves kind of spun up, concerned, anxious by trying to self diagnose?
Well, I think there's good and bad to all of that. But I think the part that I feel is important is for patients to educate themselves and be involved as an educated healthcare consumer, to feel that they have some knowledge to be able to ask questions
Yeah.
and not just
Blindly.
be beholden to, what the doctor says.
Yeah.
And I think, I mean, as a physician, we can't know everything, and we certainly don't know you. And so to have a comfortable, open line of communication with your practitioner, to be able to be honest with them and express your concerns and to give them an honest background about your own medical history and those types of things, I think is really, really valuable and is a critical component of getting good care. Is that line of communication, because if I don't know something about you, or your willingness for particular types of treatments or your approach to things, then it's hard for me to give you good recommendations.
Sure.
If you're somebody that's really doesn't want a prescription for something, or if you're somebody would rather have a prescription for something,
Oh,
it's
sure.
just, I'm here. I'm not here to tell you what to do. I'm here to facilitate access to what it is that you're looking
Mm.
for. And I think all of that is just, I think it's trust and an open line of communication. And it's hard to do when you have like 5 minutes or 8 minutes with somebody, which is, if you look at the statistics, the amount of time practitioner and a patient have face to face, it's minuscule compared to the amount of time that is spent for documentation and getting your insurance approval and, all that stuff that's not important. So,
Yeah. I had a concerning experience with my primary care or my past primary care doctor last year where I went and got the blood test and my LDL was high. And immediately she's like, statins. I was like, this seems a little, can't we retest? She's like, nope, that's not how we do it by the book. The book is statins immediately. We get one test, statins immediately. I'm like, I want to retest. We retest in a way, and I also have a holistic like health doctor where I'm just using the primary care to get me lab tests that are discounted, so then I can then bring it to him and
mm-hmm.
give me access, to insurance benefits, but really not unfortunately not really thinking much of what they have to share with me, my primary care. Um, and so retested and in a way that my holistic doctor shared of like, okay, get it more specifically in these kinds of ways. And it was completely normal. It was great. It was like strong. And I was like, that was so scary. Like how many people are getting prescribed things where it's like just retest or test in a different kind of a way. And
Mm-hmm.
when I was sharing this with the primary care of like, hey, we can actually break down these cholesterols into like subcategories, and she's like, I don't even know what you're talking about. And she's like, I don't think LabCorp can do that. I'm like, whoa, I'm the first person to even say this to you. And it was really, it was frustrating and it was sad.
Yeah.
And it's scary for
Well,
me where she's like, you have to go on statins, even though I'm like, I don't really believe you, but still, there's still I'm like, I believe you a little bit.
yeah. Well, and I think I agree with everything that you said, but I can give that physician grace if they're like, "Oh, I need to learn about this. Tell me more.
Yeah.
What did your functional doctor say?"
She pretended like she knew what I was talking. I could tell she was pretending like she's like, "Oh, I know what you're talking about." She did not want to be educated. She's like, I'm the, well, I don't know, holier than thou.
The expert.
Yeah, I'm the expert. It was a bit narcissistic. Like, I know everything and just listen to me. Why are you even asking me questions?
Yeah. And that's the part that's disheartening because I mean, there was a point where I was on the other side of the camp. Like patients would come in on thyroid and they'd say they're taking thyroid to lose weight. I'm like, what, are you kidding me? Like what?
Hmm.
And things that I was kind of rolling my eyes at. And at the same time, my sense was like, well, this is what my patients know or are hearing and learning, and I need to walk, hand in hand with
Hmm.
my patient because I need to educate myself about these things, whether I believe in them or not. I need to know where everybody's coming from. And that's when my eyes opened. I was like, oh my God, I had no idea that it could be so different, and that's such a different perspective. And yeah, there's kind of no turning back once you see it. There's no not seeing it anymore. And it's hard to. So I'll give you an example of someone else. So I have a friend who's a pediatrician, and she does locums work, meaning she goes to different offices. If
Hmm.
somebody's pediatrician is out for maternity leave or
Hmm.
whatever, she goes and fills in. And after learning and understanding more of the integrative and functional approach, she says, I can't do that anymore because I can't go into an office as a plug in and repeat the same things that everybody's telling these patients when I don't believe in that anymore. I know there's a way to do this nutritionally. I know there's a way to do this from a functional, more holistic approach. So I can't keep preaching the stuff that's being, spewed out there any longer. So, that's the piece of it where, it's important to be, walking hand in hand with somebody that's got an open mind. But to their defense, if they have 10 minutes to see, 50 patients in a day, each patient a day, it doesn't, how do you can't make the numbers work, like you
And this
don't
is how
have
they're
time
being
to.
told to do it as well. They're like, this is when I asked her about it, and I asked my new primary care about it. I was like, they're like, yeah, this is just how we're told to do it. There's a playbook, and they're just following the playbook. These are the rules. This is the guidelines, and we're
Yes.
following them to a T.
Well, and if you're so coming out as a freshly minted physician, sometimes people are coming out with $300,000 or $400,000 in debt. So you don't have the funds to start your own, hang your own shingle. You don't have the money to rent an office, hire a staff, buy the computers. I mean, just from a logistical standpoint. And so what do? You get hired by the hospital or a big group, a big physician group. So then what do? You practice the way they tell you to practice. So it's the whole system is, kind of problematic from that standpoint. But to your point, in terms of your lipid profile and whatnot, I mean, there's a book called The Statin Disaster, which if you want to read that one, but it talks about if your LDL levels are low and you go into the hospital for sepsis, you're much more likely to die with a low LDL level. Because they're working really hard with statins to get your LDL. Well, it's an active part of your immune system, and if your LDL levels are low, you're more likely to die of sepsis in the hospital.
This podcast is brought to you by B Micro, organic freeze-dried microgreens for easy everyday nutrition. Sprinkle them on any meal and enjoy the benefits. Shop now at bmicro.farm and use PLANT15 to save 15% off your next order. So you went from plastic surgery, then got inspired by wellness. Can you share about that moment where you're like, okay, I'm going to start another business to help support my patients and my primary here?
Yeah, it's a little bit back to like you can't unsee what you've already
Right.
seen. Is when we first started, maybe whatever it was, 10 or 15 years ago, people weren't doing this. Like the folks that you want doing this are the primary care, family practice, the OBGYNs. They're the ones that should be doing this care. But there weren't many, if any, doing that. And so I mean, it was almost a sense of responsibility. Like, who's going to get this out to the patients? Because it's so important to everyone's health and the health of this country, that we have to kind of start pushing the needle in another direction. And I mean, I personally benefited from it, and all the people that we were treating were benefiting. And you just feel such a compulsion to get the word out and help people. And so that's how we ended up starting the practice. Is like nobody else was doing it, and we had a mechanism by which to learn how to do it and to do it in a healthy, productive, beneficial way. But I think part of the reason that I'm part of this kind of wellness collective is that we need to figure out how to monetize it. Because if there's no money, there's no mission. I mean, we can't do this charitably. And it's hard to make money doing this because it's not a high ticket item. I mean, if you can help people through their food and some supplements, get healthy, it's not like it's a big money making machine. But we have to figure out how to make it profitable for practitioners who are doing it so that they keep doing it, and grow the population that has access to it.
Opposed to profitability in pharmaceuticals?
Right, or procedures. So if you look at the cardiologists, I mean, if we can help get people's cardiovascular health better through nutrition and some supplements and getting their hormones done, then there's no money in the stents and the, open heart surgeries and whatnot. And so it's a little bit of a money problem,
Yeah. Share more about, do you pronounce it Besana?
Basana.
Yeah. Would you share more? What does that stand for?
So it turns out that sana in a lot of different languages means many positive things, like it can mean radiant and brilliant and sound, like of sound health and body. And the B is just be. So what we're looking for is, how do we be vibrant, be healthy, be beautiful, be energetic, be healthy, be sana, as if that's kind of where the name came from,
It's
is
funny.
we're trying
I
to,
have a B name as well, B micro,
yes.
with a focus of just focusing on the small things that add up to the big things.
Yeah, I love it. So yeah, we're on the same page. That's that standpoint. And it's hard to find words that are like sana actually means, like I said, positive things in many languages, as opposed to in many languages it's positive, but it also means something bad in this language.
Mm.
But it is exactly that. It's like the more active, like how do you engage to be whatever it is that you want, and
Mm-hmm.
that's our goal for our patients.
Mm-hmm. What are the most popular plastic surgeries right now?
So I'm kind of making the assumption that we're talking about cosmetic procedures,
Yes.
and I would say probably doing the eyes, in particular the upper eyelids, breasts, whether they're bigger, smaller, perkier, and body contouring, liposuction, tummy tucks, things like that. Mommy makeover is probably a common term that you might hear, and it's really, I don't know that it means anything specific, but it's kind of rejuvenating those areas that
Mm.
mommies lose after having kids. So again, breasts, whether they're bigger, smaller, perkier, tummy tucks, liposuction, body contouring, that kind of thing.
Does Botox play into that at all?
Um, I guess that I don't look at it as being plastic surgery
Mm-hmm.
necessarily, but we do in our practice offer aesthetic services.
Mm.
So it's the type of things that I wouldn't necessarily be doing, meaning we have amazing nurse practitioners and nurse injectors. So they do like our volumizing, so fillers, plumping up the lips, skin care, lasers, things like that. And yeah, Botox.
Mm-hmm. What's your opinion on Botox? Who's it for? Maybe who's it not for?
Hmm. So generally, it's really great, particularly around the eyes. So if you have the little wolf lines or the smile lines, it's both a treatment and preventive, meaning I feel like Botox gets a bad rap. I don't really know why, but Botox has been used for decades, and in fact, it's considered safe as far as they have used it in the past to treat infant, newborn club feet. So if you can use something in an infant, it's probably pretty safe.
I've heard of the benefits for TMJ and maybe like
Hmm.
chronic migraines.
Yes, because what it does is it helps to relax the muscle. So people that haven't done it or tried it feel like, oh, it just freezes your face. Like you can't, express
It's like
you have an
stereotype
expression.
of it.
Right. So yes, if you use a lot, it does paralyze the muscle.
Hmm.
But especially in Colorado, patients want to be very natural and expressive and all that. So you still want to be able to, make a make I'm unhappy with you face at the grandkids or
Hmm.
smile and look expressive. You can still do that because it's dose dependent. So you put in enough so that it relaxes the muscle so you're not driving these deep wrinkles into
Mm-hmm.
your skin and damaging the collagen, but you can still raise your eyebrows and make a squinty face. So it's dose dependent. So from that standpoint, you can still be expressive and not paralyzed, but for I don't know, maybe if you're from California or Florida, you don't want any wrinkles and you don't want to be expressive. So you can put as much in there as you want as far as actually paralyzing the muscle. But yeah,
There's
it's
no
you don't have to do
long-term
that.
negative health effects from it.
No.
Wow. Uh,
It
I,
it just helps to block signals so that your muscles aren't responding to the nerve to move the muscle. So it just helps to relax. And it's one of those things I tell patients, the reason that you hear so much about it and people love it is because it works. It helps to soften those wrinkles. And then if you're not driving those deep wrinkles, into your skin, then it's going to be preventive, but it also, keeps you from making those wrinkles. But it's kind of like cutting and coloring your hair. If you love it, we got you because you have to come in every 3 or 4 months to do it because
mm,
it's not permanent. But
mhm.
it's also something to try because it is very effective. Again, you hear about it a lot because people really like what it does. And so if you try it and you don't like it, then it's going to wear off. So then, you could check it off your list of stuff that you tried and didn't like. But a lot of times we gotcha because people do like it the way it works.
What is your opinion on popular peptides like GLP-1s, Ozempic?
Yeah, so what I would say is, I mean, again, there's good and bad to everything. Initially, I was very skeptical. Okay, it's just another quick fix for weight loss where, we need to be looking at hormones and thyroid and nutrition and movement and stress and all of that. But part of the reason peptides, I think, are going to become really an integral part of care is that they are signaling molecules. So if you think about most pharmaceuticals, they will either poison enzymes or they block receptors, meaning they're doing things that your body doesn't naturally need or want, right? It's stopping it from doing something your body naturally does. And so many of those types of pharmaceuticals, you can predict what the side effects and the bad problems are going to be downstream because you know the mechanism by which it works. So, for example, like the cholesterol blockers, we know where it blocks cholesterol production, but it's going to affect all the good things downstream that you need cholesterol for. So, for example, from your high school biology, I mean, cholesterol makes up every cell wall in your body. So you need it. And cholesterol is the Lego building block for a lot of your sex hormones. And it helps with energy. So, it's really important to know what it's doing and why it's doing it. But if you're going to block a natural mechanism in your body, you're going to have side effects downstream from there. And most of them can be predictable. The difference in my mind really with the peptides is that they help your body to work better because they help your cells to communicate better. And so even with things like the GLP-1s, we tend to see a lot more side benefits than we do side effects. And a lot of the side effects are dose dependent. So if you give somebody that's not diabetic a diabetic dose, then it's potentially going to cause other problems, or side effects. But we believe in a minimal effective dose. So we start low and then we titrate up. And when a patient starts to lose 1 or 2 pounds a week, then we stop. We're not increasing the dose. So we don't tend to see so much nausea and like pancreatitis and, those other sorts of problems. And, people talk about hair loss. Well, hair loss is very complex, or hair. And so, do they have a good thyroid level? Do they have the nutrients that they need to make hair? So most of the time when people lose hair, like in response to, say, doing testosterone or something like that, we look at the other reasons why they might be losing hair, because it's unlikely in my mind that it's just that one thing that's causing the hair loss. It's like, well, do they have vitamin A, vitamin C, vitamin E, biotin? Are their thyroids working properly? Do they have the iron they need? So I would say in our practice, we have patients losing weight on our GLP-1s with very minimal side effects.
And is that something that people can expect to be on for life? Is it a 1 year thing?
I think it depends on each person. Why is it that you're having problems with your weight before? And I think if you control the other factors, like let's get your hormone levels up where they need to be, let's get your thyroid to where it needs to be, let's reduce your stress, let's improve your sleep. If we're doing those things, and I think people might not need them at all, they might be on, once a month, a little whiff for a maintenance dose. I think it's different for different people.
What's the difference between a plastic surgeon and a cosmetic surgeon?
Well, plastic surgery is a broader category, if you will. So some hand surgeons come through plastic surgery training, maxillocraniofacial surgeons where they're rearranging skulls and, things like that are plastic surgeons. People that do burn care are plastic surgeons. People do breast reconstruction are plastic surgeons. People do that cosmetic surgery are plastic surgeons. But I think I mentioned earlier there's a thing called Cosmetic Surgery Board, but it's not an official American Board of Medical Societies board. It's a made up board for people that are coming from other specialties and doing cosmetic surgery. So most plastic surgeons will actually use the official certification logo on their websites, and other surgeons who are cosmetic surgeons but not board certified plastic surgeons are not allowed to use the insignia in their marketing or on their websites and things.
What is the most dangerous plastic surgery?
Well, there's something called the Brazilian butt lift, which is fat transfer to the buttocks, and it has the highest death rate in plastic surgery. And you would think, okay, we don't need to be talking about death in cosmetic plastic surgery. But just to explain, so the patients that died having the procedure done, they had fat injected in and around the big blood vessels that go into the legs. So it's a fat embolus, just like you can die from a pulmonary emboli. You can die from a fat embolus. So if you don't know what you're doing and you're injecting deep, such that you're getting fat in and around these big blood vessels into the legs, then that's a problem. But those that are properly trained are not going to be doing that. We're not injecting deep into the buttocks. And it also has to do with fat and the way it survives. So when we transfer fat from one part of the body to another, they're live cells and they need food and water, meaning they need a blood supply. And the best blood supply is close to the area right under the skin. So the deep tissue, like fat, doesn't have a lot of blood vessels. So we don't tend to want to even inject deeper. I think initially when people first started doing the procedure, they would try to inject into the buttock or the gluteus muscle because there are
Deep.
blood vessels there, right?
Wow.
But that's not the way to do the procedure. So again, kind of you want to be the first line of looking for a plastic surgeon at all is making sure that they're board certified by the Board of Plastic Surgery and not cosmetic surgery.
If there was a plastic surgery capital of the world, where would it be?
Maybe Korea right now.
Why do you think that is?
Just the patient population is very open to it's not, I don't think is, I don't know, historically taboo or whatnot. And I think they're well trained surgeons there.
You also hear about Brazil. Is that a top five?
Yeah, probably. Yeah. And a lot of technology comes out of Korea as well. So,
What would you say the mainstream story in the U.S. is about plastic surgery? What's maybe the taboo or the misinformed story on plastic surgery?
that there's a lot of bad plastic surgery. I mean, we certainly see bad results and whatnot. And I think we kind of mentioned that, unfortunately, for plastic surgeons, the results that people notice are the bad ones. But that doesn't necessarily mean that most plastic surgery is bad. I think we just don't see or notice things that are really natural and whatnot. And I think, potentially it's just been sort of a no-no to cheat, I guess, to do something that's not quote unquote natural or something like that, I think has been a little bit of the taboo. But it's become more and more mainstream, and I don't know if some of it's because of the shows that we see on TV or just the nature of time, but I mean, I think most people would be surprised at the people around them that have had plastic surgery. I think would, yeah, be shocked.
How much does mental health play into some patients with plastic surgery? I just think of Hollywood where, there's so many photos of these actors and actresses where you can just, before and afters can be pretty obvious. And some have so drastically changed their looks. I have a curiosity of like, is there some maybe depression there, that some not enoughness that is really leading the inspiration? They're moving from a place of fear. They're making decisions from a place of fear, not enoughness.
Yeah, I mean, I think there is some of that, but again, I think people might be surprised that it's not such a big percentage. So there is a formal diagnostic code called BDDS, body dysmorphic disorder, and where as a plastic surgeon you should never operate on someone who just because they would never be satisfied. They are coming from a distorted image of themselves, and that is really it's a psychological psychiatric diagnosis. and no one would be able to ever help make these people happy, if you will. But surprisingly, I think really most people just want to look and feel better
Sure.
without a real sort of shortcoming of themselves. People, I mean, we wear hair a certain way, we wear makeup, we wear jewelry, we wear certain clothing. So, where sort of the gray line where all of a sudden it's a bad thing and you're doing it for the wrong reasons kind of thing. I feel like, with the plastic surgery, part of it is, if you have the resources to do it, if it's something that's really bothered you, patients are super happy afterward. It's
Yeah, they're
just
not hurting anybody.
yeah, and it's one less thing that they are
Sure.
bothered by or whatnot. They fit in their clothes better, whatever it is. But
If I were to get a little work done, any suggestions?
no, your skin's amazing
Oh,
and you're
thank
at a
you.
good weight, and yeah, I think you're looking good.
Okay, this was going to be a practice and not taking things personally. Where can people learn more about your work and you?
Yes, so our website is atagimd.com, and we're at besanawellness.com. But just Googling Tanya Atagi, Atagi, so like Atari with a G, and I'm sure my name will pop up somewhere. But yeah.
And you're in the Denver area?
Yes, so we're in the South Metro area. So technically we're in Lone Tree, Colorado, so south of Denver.
Anything else that you'd like to share?
I think you've done an amazing job dragging out all kinds of things.
Here's a question: if there is one conspiracy that you believed in our medical system today, what might that be?
I mean, I'm not a conspiracy theorist, but the drug companies have a lot of money and a lot of deep connections to the people that make the rules. And I think it's gotten us as a country into a lot of trouble because in the different ways that we offer hormone therapy, for example, are pretty basic things that have been around for 80, 100 years and are still widely practiced in other countries that have more national healthcare systems and whatnot that are not pandered to by the pharmaceutical industry. I think that's unfortunately a really big component of why we're where we are.
Are there any pharmaceuticals in particular that you think people should be leery of? Maybe not naming them, but like a category of pharmaceuticals, like
Yeah. So statins. I'm not a cardiologist, so I'm not going to tell somebody they shouldn't be on a statin, but you need to understand the ramifications of being on statins. I think like I said, the artificial fake bone building medications, like if we have people properly hormone balanced, we can increase their bone density by 8 to 10% every year by making healthy new bone. All the things that you take for stomach acid, it really affects your health in terms of affecting your GI tract because your stomach is acidic for a reason. It helps to break down your food properly. It helps to kill and neutralize bacteria getting into your system. So there are better ways to deal with an upset stomach. I would say those are three very big categories. Yeah, that there are better ways to treat the problem at its root cause as opposed to masking symptoms.
thank you, Tanya. You've been a friend and ally to me for a long time. You've given me a platform. You've come on here and shared in this good way and referred me to so many great people as well. Where does that referral kind of inspiration, that community connecting, how would you describe yourself in that way? Because I think you have connected me with more people in Colorado than anyone else I could think of.
Uh, what makes me happy is seeing people happy, and I love when people find each other and are able to create relationships and collaborate. I mean, it's super valuable, of course, and important as a business owner, but I think it's all about relationships, and a lot of times there are problems that I can't solve or I don't have answers to, but when we have those resources and other people to be able to connect, I think it's super fun and it's really rewarding. And Yeah, it's selfish. It brings me a lot of joy
Yeah.
to do that and see those relationships. So,
Mm.
yeah, it's more self-centered than
That is beautiful that we frequently do get receive more when we give.
I think that's very true.
Mm-hmm.
Yeah.
Great. Well, thank you so much for the time, the sharing. Anything else that you'd like to leave us with?
Thank you. And I love what you're doing. I mean, with for those of you that have been following, you with your podcasts and all, you've really connected with a lot of amazing people.
Thank
So
you.
we love what you're doing is bringing all this information to everyone out there. So thank you.
Thank you so much. Okay. See you, everybody.
Thanks.